Hello, I am Dr. Rakesh Periwal and we will be discussing about ambulatory blood pressure monitoring. It's basically taking repeated blood pressure measurements by a device which is small and can be attached to the body with a cuff around the arm, just as we do in a normal blood pressure recording. And this records blood pressure usually every 20 to 30 minutes during the daytime and every 30 to 60 minutes during sleep to give us the BP profile over the 24 hours. The reports can be generated in a software which gives you the report in numbers, in graphs, and also a brief summary. Why do we need it? Well, that's the only way we can get an average of blood pressure over 24 hours, and very helpful when we suspect either white coat hypertension or masked hypertension. We know that BP has variability during the 24-hour period, and this is the only way to know about the pattern and control. And there is a special interest about nighttime blood pressure. ABPM is the only way to know about it. And also we can pick up episodes of hypotension if we suspect there is some intolerance to antihypertensive medicine. Why isn't it so popular? Well, if I talk about myself, the inhibitions I had was because there was not much in the guidelines. I didn't know much about how it's reported, how it's done, where the equipment is available, the costs. And the inhibitions went away once I got an ABPM device for myself. Who should be advised ABPM? Well, lots of guidelines. Some say all patients, grade 1 hypertension at the time of diagnosis, just to establish the diagnosis. For others, it could be looking at the 24-hour efficacy. Patients who do not tolerate medicines, whether they have postural hypotension, we can pick it up. Those whom we suspect to have nocturnal hypertension, especially patients with diabetes, obstructive sleep apnea, and chronic kidney disease. How many readings do we need to interpret? Well, 20 daytime readings and 7 nighttime readings will do. We will talk about the guidelines. And the softwares are there to preset it, or you can do it as per the diary kept by the patient. That depends on the device and the software that you use. The definitions of blood pressure as per ABPM, if you look the ACA-AHA cut over 130/80, then the mean daytime BP is same 130/80. That's the cutoff for hypertension. Average 24 hours BP lower than that, more than 125/75 it's hypertension, and mean nighttime 110/65. So we see the nighttime BP is much less in normal people and it's physiologically advantageous. And there's a lot to talk about nocturnal BP, the dipping, the reverse dipping, and isolated nocturnal hypertension and the implications it has on cardiovascular diseases. We will discuss that. Report format, well, it's very simple, comes as tables, gives you the idea. All you need to know about is the 24-hour average BP, the average daytime blood pressure, and the nighttime blood pressure. And you might also get a short summary. It just needs a little bit of training to interpret. Just keep a small checklist when we do. We will talk about all these. Only thing you need to tell the patient is to avoid exercise, strenuous activities, and also driving. They should not do that. So you got to have normal daily activity, and obviously they cannot bath, and warn them that there could be some discomfort due to the cough. And the only, I can say, the relative contraindication is when you suspect irregular rhythm like atrial fibrillation, ABPM should not be advised. So we come to a point in my career, I never did an ABPM for the first 10 years of my life. And now we have come to the other extreme when we are looking at doing it for all patients. Well, do all your hypertensive patients need a ABPM, or when do you think you should suggest an ABPM for your hypertensive patients? Let's discuss all these when we meet this 12th at 5:30 p.m.